And first, for the rest of the morning, is Dr. Jordan Rullo, who's going to be giving us a kind of if you were here 2 years ago, you got to hear her number 1 sexual health talk, and this is her number 2 sexual health talk, and the title is A Pill to Cure Low Desire. Welcome, Jordan.
Thank you for having me. Well, welcome, everyone. Thank you for being here. My talk is A Pill to Cure Low Sexual Desire and Other Popular Sexual Health Beliefs. I have no disclosures. Learning objectives: to recall the efficacy of flibanserin, to describe the relationship between mind and body sexual arousal, to explain the appropriate use of kegels, and to list the pathways to female orgasm. Okay, so first one is, a pill cures low sexual desire in women. Is this fact or fiction? You don't have to answer this. Just think in your mind whether you believe this is fact or fiction, and we're going to answer this together. First, before we answer this question, we've got to talk about, well, what is low sexual desire? What causes it? Now, the way I wrap my head around low sexual desire is through a model, and that sounds really boring, but this is a really great model, and it's called the dual control model. Anytime you have a patient coming into your office who says she or he has low sexual desire or really reports any sexual function concern, so I'm talking about difficulty with orgasm, difficulty with arousal, you want to think about this model. This is extremely helpful, and it really often makes sense to patients. So let me describe this to you. This is called the dual control model, and basically it's based on this idea that sexual function is based on a brake pedal and a gas pedal. And things that hit the brake pedal are going to be poor body image, history of trauma, maybe you're exhausted. Things that hit the gas pedal are going to be maybe your partner smells good or looks really good, or there's novelty in your relationship. And in order for sexual function to function, and this is exactly how I describe it to my patients, in order for sexual function to function, you've got to have more hitting on that gas pedal than hitting on that brake pedal, which intuitively makes sense, right? But most of the patients I see that have been to their primary care doc or a healthcare provider who doesn't specialize in sexual health before they see me, they'll say, yeah, I went to my healthcare provider and told them I have low desire, and my healthcare provider said, just go on a date night or light some candles. So the suggestion was, just add some more gas on that gas pedal. But we know from the research that the first line of treatment for any sexual health concern, especially if we're talking about low desire, is not about the gas pedal. It is about the brake pedal.